Hi, my name is Zangam Sakozi, the co-founder of MedSearch Zambia, and I'm a pharmacist by profession. Do you own a pharmacy and you want to increase your visibility to more clients? With the increased number of pharmacies opening in the country, visibility plays an important role in your business. Come on the MedSearch Zambia app and we'll help you become more visible to more clients across the country, not only in your local area. With you coming on board on the MedSearch Zambia platform, we'll be able to tell people where you're found, be able to tell people what services you're offering and what medication is in stock. Here at MedSearch Zambia, we always say MedSearch Zambia, healthcare simplified.
MedSearch Zambia app, healthcare simplified.
Zambia Health Talk, where we invite different personnel, medical doctors, nurses, pharmacists, who are able to come and explain different conditions that we have that many people face as a country. Today, we are fortunate enough to have a special guest from UTH. She will introduce herself to you. We're looking at a condition that has got so many related myths about it still exist in the community. Unfortunately, a lack of awareness about epilepsy can contribute to stigma and discrimination, and many people out there feel discriminated when we talk about it. We're being joined by Dr. Mata, my co-founder and partner. He has joined in. Today's topic, we encourage you to invite friends to come on board and watch and listen to our health talk today as we look at epilepsy. At this particular time, I'll bring on our guests. Our guest, how are you?
I'm fine, thank you. How are you?
We're good. It's a good Friday. Not raining, not very hot, good weather. We are okay.
Yes, it is.
Uh, first to start with, I will give you this opportunity to introduce yourself, where you're working from, and what you're doing at the moment.
Okay, so I am Naluca. I'm an internal medicine specialist at the University Teaching Hospital and also a senior neurology registrar. And I'm the Secretary General for the ILE Zambia chapter. So ILE stands for International League Against Epilepsy. And we have a Zambia chapter. And also we have a young epilepsy section for members less than 40. So I represent the continent of Africa in that section, and I sit on a lot of task forces for the ILE and also for the Epilepsy Consortium. I am part of the advisory board representing Africa. So I'm vested into a lot of epilepsy work.
Maybe my second question, my follow-up question with the introduction. You mentioned one organization. What does it do, and why have you found interest in epilepsy?
Okay, so the organization I mentioned is the International League Against Epilepsy. So it's a professional body having more than 30 countries, member countries across the globe. And its main vision is that nobody's life should be limited by epilepsy. So we are involved in research, in training, public sensitization mainly. So it's mostly for professionals. And when I say professionals, those involved in epilepsy care. So it's not just neurologists, it includes just any medical doctor from the junior resident medical officers. It includes clinical officers, includes nurses, community health workers, any professional who's involved in epilepsy care. So I started this epilepsy work when I was just a junior resident medical officer. I took interest in the epilepsy clinic. By then I was working at the Levi Mwanawasa Hospital. So the late Mr. Anthony Zimba, who was the Epilepsy Association of Zambia chairperson by then, was manning the clinic. So out of interest, I just joined him one afternoon. to review a few patients, and that's how I got interested, because I just see that there are a lot of neurological disorders which are not really curable, but epilepsy is one of those neurological disorders which is treatable, and it's a shame that people still continue having seizures, and it really, really limits their quality of life.
I think you've mentioned something that is important, and many people do not really understand what epilepsy is. I think during the whole course of the week, we've been sharing information about epilepsy, how you should treat one person who's epileptic, what are the signs and symptoms, if they're going to enter into a seizure or not, what you should do for them, what you should encourage. And it has been interesting that many people had showed, for lack of better terms, not so much knowledge, didn't have so much knowledge about epilepsy. Stigma was one of the things that we discovered. People who are epileptic still face a lot of stigma. We'll now give you this platform. What should we know about epilepsy?
Okay, I think the first thing we should know about epilepsy is that it's a neurological condition. So for a long time, we've not had neurologists in Zambia. And most of these patients have been taken care of by our psychiatrists. And we're very grateful for all the work that they have done. And mostly clinical officer psychiatrists. But the disadvantage with this is it has been associated with mental health. So everybody thinks it's a mental health disorder. There was a big epilepsy clinic at Chainama Hospital. So everybody thought these people have a mental health disease. No, it is a neurological disorder. And the other thing is that we need to know is that, of course, people with epilepsy may have some comorbidities associated with mental health. And sometimes, depending on the cause and the epilepsy, having epilepsy for a long time, which has been uncontrolled, they tend to have some kind of cognitive impairment, which people would perceive as a mental health problem. But it's actually a neurological disease, and it's globally affecting about 50 million people worldwide.
Wow.
And the highest burden, unfortunately, is in low to middle income countries. And this is where we also have a treatment gap. But it affects all ages, it's prevalent all over the world. The most important thing is for people to know that it can be treated, and up to 70% of people living with epilepsy get to be seizure-free on medication. And some of its causes are actually preventable. And so most of the frequently asked questions that I encounter is people ask what causes epilepsy and how does somebody get it? And this is where we need to give people the right information. You talked about stigma. So it's on this cause of epilepsy and how someone can get it that brings about this stigma. So epilepsy itself is a brain disease. Initially, people thought it was a brain disorder, but in 2014, the International League Against Epilepsy said epilepsy should be classified as a disease and not a disorder. So it's caused by abnormal electrical discharges in the brain, and not what people believe that it's witchcraft, somebody has been bewitched, or you, and also it's called, and it's not contagious, because other people will think you get epilepsy by touching someone who's having seizures, sharing the same bed. When they urinate and you touch their wet beddings, you get epilepsy. No, that's totally not true. So the causes of epilepsy.
Sorry to cut you short. I think there's one thing that you've mentioned about the stigma when it comes to people thinking it's witchcraft. I think during the course of the week, other people are even saying, no, it's a spiritual attack. If someone is epileptic, they've got demons, like take them. So it was very interesting. I don't know if you're able to repeat that so that people can hear. It is not related to any spiritual.
Yes, so epilepsy is a brain disease, abnormal discharges in the brain. It's not related to any witchcraft. Please do not accuse that grandmother or that old person in the village or that aunt and uncle you do not like. They are not to blame for epilepsy. And so the causes, there are many causes, but they can be grouped into structural. By structural, we mean there's a lesion in the brain that becomes a foresight for somebody to have these abnormal discharges and then develop epilepsy. So you have those who suffer from stroke. So there are certain types of strokes that happen in the cortex that predispose somebody to have epilepsy. There are those who, for children, they may have some congenital abnormalities. This is where there are certain malformations or abnormalities that occur in the developing brain, and these predispose somebody to having a seizure. There are those who have post-traumatic. Let's say you were in a road traffic accident, you had a concussion, there was some injury to the brain. So that can make you or predispose you to have seizures and develop epilepsy. Then we have infections, HIV, meningitis, some viral infections, TB. There's one we call toxoplasmosis, neurocysticercosis, which is actually very common in Zambia, especially in the eastern part of Zambia. It's a tapeworm cyst, yes. So we have that. So it can form cysts in the brain, they can get calcified. All these are foresight for somebody to have seizures and develop epilepsy. We have some immune conditions where, you know, the body is fighting off an infection, then later, like NMDA, where there's an infection, later on you have the bodies and your own cells attacking each other can predispose to epilepsy. Genetics. So there are about 70% of causes of epilepsy are due to genetics. So you have these genetic syndromes where epilepsy or seizures are the hallmark. We have metabolic. So we have inborn errors of metabolism like Gaucher's disease, Lafora disease, all those will give somebody predisposition to develop epilepsy. Wilson's disease, when they have abnormal levels of copper in the body. And of course, there are some instances where the cause is still not known, but somebody ends up developing epilepsy. So there is nothing among us, all those things I've mentioned, that includes witchcraft or somebody getting epilepsy from somebody else. So I think that's one thing I always love to stress to the general public. When you see somebody having a seizure, do not be afraid to help them, because it's that belief that you can get epilepsy from someone that prevents people from helping somebody with a seizure, and these people need our help. So help them remove all harmful objects around, make them comfortable. You will not get it from them. It's not anything contagious. And then also, oh, sure, go ahead.
I'd like to bring Mata, if Mata is around. Mata?
Hey, Zanga. Hey, Dr. Naluca, Dr. Mwendaweli.
Hello.
Sorry, I will have to keep my video off. We have just lost power here, so I'm in the dark. But yeah, I'd like to jump in. And Naluca,
Yes,
Dr. Mwendaweli, you've mentioned quite a lot of things, but I think maybe so I'm a non-medical person, right? And if I was to ask, what does a seizure actually look like usually? I know there are different types of seizures, but if I am in a public place or I have a family member and I think they're having a seizure, are there certain things that if I see this, I should think, oh, this is my loved one, my friend is having a seizure? And then if they are having a seizure, are there some like first aid things, some basic things that I should do and things that I shouldn't do for a person who's having a seizure?
Okay, thank you so much, Dr. Mata, for those very important questions. So the first one generally is how to recognize a seizure. So we have a lot of seizure types, and not going into the scientific part. So there are those, especially in children, who have what we call absent seizures. So this is where some will just have a blank stare for some time. You're talking to somebody, to a child, they'll stare at you blankly, they stop what they are doing. They have what we call a behavior arrest, if I can put it that way. If they were combing their hair, they suddenly stop what they're doing, and then afterwards they continue. And most of the time, people won't notice it, but you notice it in school-going children, where the teacher will probably complain to the parent that your child is absent-minded in class. Sometimes you see their performance go down. This is because they're having multiple seizures, absent seizures, where suddenly they're zoned out of it and then come back. So they miss out information. And they don't actually realize that that has happened to them. For them, after the seizure stops, they continue. Then even in for adults, there's some who may have something similar where they just have a behavior arrest, they're talking to you, suddenly they keep quiet, and then the next thing they're talking to you about something totally different from what they were saying. So most people would say their relative is having some episodes of confusion. They're saying things that are not making sense. So you, as a clinician, I'll suspect, is this person having seizures? Sometimes they'll say this person has memory lapses. So those are little subtle things. And then the obvious things that we get to see, the motor seizures where somebody is jerking. So that's what people are familiar with. Somebody will be jerking, they've lost consciousness. Afterwards, they'll pee on themselves while they're jerking. Some may be, they may have sores in the mouth because they've bitten their tongue. So that those little things, some may just lose consciousness. So that would also raise the suspicion that somebody had a seizure. So now, what do we do if somebody has a seizure? So in short, what is the seizure first aid? So I always tell people, when you see somebody having a seizure, the first thing is be calm. We tend to panic, unfortunately. Somebody is having a seizure, people start running around, bring water, bring this. No, keep calm and make sure you keep the patient or the person who's having a seizure safe. What do I mean? Remove all harmful objects around. If they're on a bed, you think they may fall, you can carry them and put them on the floor. Cushion their head, put a pillow or something, put them in the left lateral position. So this is where you just make them lie on their left side. And then the other thing is, a long time ago, when somebody is having a seizure, everyone would be rushed to put things in their mouth. Do not put anything in their mouth. Don't put that spoon, don't put, of course, some will have tongue biting. We'll deal with it. The wound will heal in the mouth. Don't put, because you cause more injury. Some may have a locked jaw and you're just putting a lot, you break their teeth if they're fragile. So don't put anything in the mouth. And when they're having those jerking movements, do not restrain them. So even in the hospital, I've seen relatives, you find a group of 5 strong men pushing down the patient on the bed. No, you're going to cause fractures. That is a movement that is involuntary. The person is not controlling that movement. So when you're trying to restrain them, you end up causing more damage. You make the patient have a fracture. So when they're having the seizures, your job is just to make sure they're safe, put them in the left lateral position, cushion their head, let the seizure run its course. Don't restrain them. And seizures don't last long. Generally, they are less than 2 minutes. But there's an instance where we have this thing called status epilepticus, where they'll have a seizure, after some time, they won't wake up, they'll have another seizure. But of course, don't restrain them. So that's what people should do. And if somebody is having a seizure, they have one and they regain consciousness, you take them to the hospital. If you see they're having multiple seizures, please quickly take them to the hospital. That is an emergency. And so I think those are just the basic of what people do. And the other thing is just to time the seizure so that you can help the clinician to assess what kind of epilepsy they're having. You can time the seizure, you can watch them so that you can describe the seizure to the doctor. That way they'll know which type of seizure and what will be the best anti-seizure medication to give them.
Dr. Naluca, you had earlier mentioned the type of seizures that children will have, or when they're having an attack, one of them is where they do not recognize where they are and they become quiet. Out of your experience, how long, if I'm a parent, what should I look out for? Should it be if the person zooms out, maybe let's say just for 5 minutes or 2 minutes, what should I be observing? And I'm asking this because there are many parents who do not know what is happening. They will not even realize that the child is epileptic, and maybe they'll come and realize it later on when they're able to talk or when they're able to express how they're feeling. For parents who have children who are epileptic, what should they notice? What should they be cautious of?
So what I was describing is what we call childhood absence epilepsy. So it's called absence because they're absent. They're absent or absent-minded. So as a parent, so you just, if you ask them, they won't know that they've had that episode. For them, life goes on, nothing happened. They didn't experience that minute gap. You who's observing as the parent, you're the one who knows this person was out for 2 minutes. So if you see your child is having such episodes, you take them to the hospital. That way we would assess, do some ancillary tests like the EEG, where we connect some electrodes to your head that recording the activity in the brain. So they can be picked up and we can actually confirm that indeed that is a seizure.
All right. First, for the people who are watching us, if you have any questions, please do type them in the comment section. We'll be able to address them. Dr. Mata, any comment?
Yeah, Naluca, Dr. Naluca, we were talking actually earlier today, and I know we've been talking about epilepsy, and you actually corrected me because I was referring to someone as an epileptic patient. I want you to talk about a little bit about that and how important the labels we put on people is. So you corrected me to say, no, it's not an epileptic patient, it's a person with epilepsy. Why is it important that we make that distinction? And then as you answer that, the other question I want you to kind of talk about is, if I have a seizure right now, like just one seizure, am I epileptic?
Okay. So I actually make it a point to correct everyone. So everyone will say, oh, epileptics, even in whatever local language, but I say they are
Mata,
not
you couldn't correct me earlier. Yes, Dr. Naluca.
So I think it's part of curbing stigma, because you label someone as epileptic. They are not defined by their disease. It's just a disease that they have. So they're a patient with epilepsy. And even while we're discussing with Dr. Mata, I think other doctors even pitched in to say, even people who are diabetic are not diabetics. They just have diabetes. People with HIV are not HIV people. They are people who are living with HIV. So we should remove this thing of putting epilepsy on them. Oh, that is an epileptic. No, he just has epilepsy. It's not defining the person. The disease is not defining who they are. They're still the same individuals we know. It's just that they have this disease. And then Dr. Mata, you talked about having one seizure. So when you have a seizure, it's your first time having a seizure, it may be epilepsy, it may not be epilepsy. And I think in the definition, I didn't give the definition. So for epilepsy, you need to have 2 or more unprovoked seizures that are 24 hours apart. That's the general definition of epilepsy. So if I have one seizure in the morning at 8 hours, and I have another seizure at 14 hours, it doesn't fit into the definition because they have to be more than 24 hours apart. So that one at 8 hours and the other one at 10 will still be grouped into one event. So it won't fit the definition. And I said unprovoked seizures. So there are certain things that will provoke a seizure. Number one, the common one is alcohol. So when you consume so much alcohol, you are going to, you have an increased risk of having seizures. But even if you have multiple seizures, more than 24 hours apart, those are provoked seizures. So you won't be diagnosed with epilepsy. And also, there are those who have diabetes. They may have uncontrollable sugar levels, blood sugar levels in the body. And so that can predispose them to having seizures. So we won't give them the diagnosis of epilepsy. And then coming to somebody having the first seizure, when you have a seizure, go to the hospital, have yourself evaluated. We need to know what the cause of that seizure is. And depending on the investigations we're going to do, we'll determine whether you are at risk of having another seizure and indeed developing epilepsy or not. You are allowed one seizure in your lifetime. Many people have had one seizure before. They have not developed epilepsy. Some may not know what even caused it, but they've never had another seizure after that. So it will depend. So one seizure is not equal to epilepsy. You have to be investigated. Then there are some conditions where someone has the first seizure and we investigate. So we'll do neuroimaging. When you have a first seizure, we do neuroimaging with a CT scan or MRI, preferably an MRI. So if we find, for instance, you've got a structural lesion or you've got, let's say you've had a stroke before, you're at increased risk of having post-stroke epilepsy. So we may start you on medication so that you don't have further seizures. You have neurocysticercosis, we see you've got a calcification, you've got a foci, we'll start you on medication. There's some who investigate, we can't find anything, and you have not had another seizure, we won't start you on medication. Sometimes it's a case-by-case basis. If you have one seizure and you work for, let's say, ZESCO, and you are always climbing the pause, I would definitely start you on treatment because I don't want to wait for you to have another seizure. You may have a seizure up the pole and it will be very fatal for you. So it's a case-by-case scenario. But one seizure is not always equal to epilepsy. When you have a seizure, it needs investigation.
Precious Mlenga goes on to ask a question. If a patient has a brain tumor causing the seizures, can that be termed as a person having epilepsy?
So, and this is where I said other causes, structural, and I should have mentioned the tumors. So when you have the tumor, it's causing somebody to have epilepsy. You're definitely going to have recurrent seizures. Others will occur more than 24 hours apart. Yet, as long as you still have the tumor, you're at increased risk of having the seizures. You will have the seizures. In short, it's safe to say you have epilepsy. But for somebody with a brain tumor, that's something that you can have surgery and have it removed, and the chances are that you may not have seizures again.
Okay, now going on with the program, we've defined it. You've talked about the predisposing factor. You've talked about the signs and symptoms. Is it curable? What is the treatment? If I'm going to have an episode of seizures, does that mean it's a life sentence? Meaning I'll forever have it, it will become a burden to me?
Okay, that's a very good question. So unfortunately, epilepsy is not curable, but it is treatable and seizures can be controlled. So I will answer your question this way. There are some childhood epilepsy syndromes that are self-limiting. What do I mean? By the time they get to adolescent age or young adults, the epilepsy syndrome will go away. It's self-limiting. They will not have any more seizures. So when they get older, they become seizure-free. There are some who have generalized epilepsy syndromes. These ones go way into adulthood, and these tend to be on medication for a very, very long time. And there are some who develop epilepsy in adulthood. Now, most of the things in adulthood are because there's something that has caused epilepsy. There's a foci or something. So for instance, you have a brain tumor and you start developing seizures. As long as that brain tumor is there, you have the probability of having recurrent seizure is very high. So as long as that tumor, there's no epilepsy, there's no surgery, neurosurgery that has been done, it's still there, you will still have seizures. There are those who come with post-stroke epilepsy. So these are people who've suffered a stroke, and that scar that is there, because that's a space-occupying lesion on its own, it will predispose them to having seizures, and they develop post-stroke epilepsy. Unfortunately, there's nothing much we can do. We just give them the drugs. So we have medication available that will control seizures, and 70% remain seizure-free on medication. So there are some who will need medication for life. There are some who may not. It depends on the cause of the epilepsy.
Dr. Mata, I'll try to bring you on board. I'm trying to look at if there'll be any questions in the comment.
Yeah, sure. Please look for those questions. I know people are asking all sorts of things, and it's important we answer them. Dr. Naluca, just to go back to when you're talking about the childhood epilepsies, and we started right at the beginning to say epilepsy is not witchcraft. But one of the things people say is, no, it must be witchcraft. His grandfather had it, his father had it, and now he also has it. There's nothing else that can explain it but witchcraft. But we know that there are these genetic type of epilepsies. Could you talk a little bit more about those, and how is it that it goes from generation to generation?
So these are, I mentioned genetics on the causes. So especially the primary generalized epilepsy. And unfortunately in Zambia, we don't do genetic studies. So we may ask you about family history. Is there epilepsy in the siblings, in the parents, close relative to the parent? And unfortunately for these, we have to treat for a longer time because it's genetics. It has to do with, if I can explain it in simple terms, your molecular structure of the body, your DNA, or there's some with mitochondrial diseases that predispose to them having epilepsy. So I'm trying not to sound very scientific. I'm trying to look for the correct words.
That's perfect.
Yes. So I'm trying to have this, I'm trying to find correct words that would be easy to understand. So it's to do with the genetics of the body. So, and sometimes, you know, genetics, it may be passed on from a parent to a child. And that's why the family history is very important, and to give the clinician a high suspicion to say this one probably has a genetic kind of epilepsy. Though there are some where there's no family history, no one has epilepsy, and what we call, what happens is they develop mutations in their genes that predispose them to having epilepsy. So they may not always, it may not always be that it's a family thing. Others, it may just arise because somebody gets to develop genetic mutations in their body that may have seizures as a hallmark of the presentation.
Thank you. So there has to be a first one in the family for everything, right? Unfortunately, including epilepsy sometimes. So the other question I had was, okay, so I've been diagnosed with epilepsy. I don't have a structural lesion, but I have epilepsy. Are there certain things that, even with a diagnosis known, things that can increase my risk of having seizures? I've been started on medication.
Yeah.
Are there things that can increase my risk of having seizures?
Yes, so they are, so just because you've been diagnosed with epilepsy, and at least I think in the definition I said unprovoked seizures, but if you have provoking factors that may make you have seizures. So I say the most common one I have come across is alcohol. So you already have a predisposition to developing recurrent seizures because you have epilepsy, and then you put you have this provocative environment that makes you have a low and even lower threshold, like alcohol. If you have very poor glycemic control, your sugar gets to be very low, which we see also in people who take alcohol because they won't eat. They're just taking alcohol and they'll go and sleep. So you have alcohol, you develop hypoglycemia. So you come in with seizures already on top of your epilepsy. So it may not be that your epilepsy is poorly controlled. It's because you have these provocative factors. There are other specific things that would look for that are provocative. There are those who have what we call photosensitive epilepsy, where flashing or flickering lights will trigger a seizure. Even just watching TV, when you are watching, I think on DSTV, there's the E channel where there's a lot of photography, and they usually warn viewers to say, if you have photosensitive epilepsy, this may not be a good program for you. So that can trigger. And also even an open flame. I remember when I was working in Chikankarta, I came across a few patients with epilepsy who had burns. And so the history is that they were seated by an open flame by the fire. So that was already a trigger. And the patient developed a seizure and unfortunately fell into the fire. So we have people coming with such stories. So they also, and the other thing is sleep. So when you have epilepsy, sleep is very important because when you're sleep deprived, it may actually trigger a seizure. So you may have epilepsy on treatment, but you should also, you should know what triggers your seizures and try to avoid them.
I'm going to take you, like, looking at everything. I've got epilepsy. Let's talk about the mental aspect about it. I'm afraid. I remember there was a story of a lady in Kalingalinga who majority of the men couldn't date her because they felt like we've said earlier, they thought maybe she was demon possessed. If we look at their mental aspect, how do I face the world if I've got epilepsy? Not I'm epileptic. If I've got epilepsy.
Okay, so I think your question borders on stigma.
Yeah.
And the only way we can actually get rid of stigma is public sensitization. People need access to information and the right information. So for a long time, people have thought epilepsy is witchcraft. So even family members would try to avoid telling people they have that diagnosis, or they'll accuse some uncle and the patient won't have treatment. Some believe that if you have epilepsy, you're demon possessed. So they'll take you to the pastor. I don't have anything against our religious leaders. And I do have faith, I'm a Christian. But going to the church is a good thing, but that's not the solution. You need to go to the hospital and get started on the right medication. You will have faith, but even God gives us knowledge on what to do. Keep your faith, pray, take your medication as well. And so sensitization of the public is important. That's a message we need to get across. It's nothing to do with witchcraft, demon possession. It's a brain disease and it's completely treatable. Somebody can be seizure-free, can live a normal life without you knowing that somebody has epilepsy. And the most important thing is social support. If family members can support you, you can go to school. Initially, there was a time we had a program where people with epilepsy or children with epilepsy go to special school, but now we're advocating that let them just go to normal schools. Educate the teachers on what they should do if this one develops epilepsy. Tell the parents your child is safe, take them to a normal school. The teachers know what to do. And it's also a time for the other pupils around to learn about epilepsy, and they can get the right information. So I think for your question, it's borders on stigma. So we need to give the right information.
We've got a question from Catherine Mwindi Sakala. She's saying, my uncle has been with epilepsy for 15 years and on medication. Is there any possibility of recovery? I think you answered that. I don't know, maybe you can add again. But I'll bring in the aspect as we reach the conclusion of our streaming. We have seen an increment with alcohol misuse by many youths. And we have seen many now having more episodes of seizures. What would be your encouragement? And I think many people are watching now. Alcohol abuse, or let's say, alcohol abuse, substance abuse, which is leading to people now having seizures.
So I think people who are abusing alcohol, especially the youths, need help. So if you are such a one, you have a bright future. The future of this country depends on the youths. We are the ones who are going to be the leaders of tomorrow. So we need to take care of ourselves, and it starts now. So if the country has to grow, we have to be very productive. We have to be productive people so that we can have a good gross domestic product. And if we are a sick generation, we can't move this country forward. So we really have to take care of ourselves. I know alcohol is addictive, others are into substance abuse, cocaine, all these trigger seizures. So you need help, and you need to be intentional about getting help and curbing that device of substance abuse. And Chinama has a very good alcohol detox program. You can check yourself in. I know most people would associate Chinama with mental health, mad people, but even alcohol can end up causing psychotic manifestations or mental health diseases because of alcohol. So you can imagine where you develop seizures from the alcohol. And remember that when you have a seizure, you are at increased risk of dying. You may end up in status epilepticus or have sudden death because of epilepsy. So you can't take it lightly. Or you may end up developing an alcohol-related mental health disorder, which will not be good. So you have a bright future, don't ruin it.
Monday is World Epilepsy Day, if I'm correct.
International Epilepsy.
International Epilepsy Day. Why is this important as we come to the conclusion? I'll bring in Dr. Mata later on.
Okay, so International Epilepsy Day is joint initiative by the International League Against Epilepsy, which I explained. And then there's another international body called International Bureau for Epilepsy. So this one incorporates patients. We have a lot of people with epilepsy that are involved in that organization. So it was a joint initiative by the two organizations and WHO to increase awareness of epilepsy. And it's celebrated in over 130 countries globally. And it's been there for some time, and it's celebrated every second Monday of February. So it doesn't have a fixed date, it's every second Monday of February. And this year it happens to fall on Valentine's Day. So with the day it's falling on, our theme is show love to people with epilepsy. Love someone with epilepsy.
Dr. Mata, I'll bring you in. Any addition? Show love.
Yeah, so I'll obviously just call on everyone to help us commemorate this very important day, International Day of Epilepsy. So all the men especially, you have an excuse. Don't celebrate that other thing, but we'll focus on epilepsy on Monday. So I think I had just one last question for Dr. Naluca. So I am a person with epilepsy. I'm doing well, but is there any advice you would want to give me for activities that you would advise me to either be careful of or even maybe not do if I have epilepsy? Are there certain things I should not be doing? I remember a story of, I can't remember where, but there was a story of a child who was known to have epilepsy. And unfortunately, they weren't swimming or something like that, and then they drowned. And the theory was that maybe that child had a seizure while they were swimming, and that's why they drowned. There are certain activities that we would advise people with epilepsy to be careful with.
Okay,
Maybe,
so
sorry, Dr. Nalu, maybe I'll bring in just another question. Is there any support groups? Let's say I'm a parent and my child has epilepsy. Is there any support group that you know of that I can be part of so that I can learn more and learn how to take care of someone who's got epilepsy?
okay, so I'll tackle Dr. Mata's question first. So things that they should not do. So I earlier mentioned that people with epilepsy can live a normal life as long as they're on treatment and they're consistently taking the medication, and that is the right medication, and their seizures are controlled. So of course, somebody whose seizures are not controlled, you will need to be extra careful because you may not know when they'll have a seizure. And they have frequent seizures, so you need to be careful. Swimming, maybe a dangerous activity, so you need somebody to be there to closely supervise because they may have a seizure while they're in the pool and then they get to drown. For somebody who's been on medication for a long time, they've been seizure-free for a long time, more than 2 years, they can begin to live a normal life, take part in sporting activities, get married, have children, but they should also exercise caution because we don't know when the event may happen. But they can live normal lives.
Is there any group that, yeah.
Oh yeah, your question on support groups. So yes, we do. So we have the Epilepsy Association of Zambia. It was formed in 2001 when the global campaign of bringing epilepsy out of the shadows was launched by the World Health Organization. So the Epilepsy Association of Zambia incorporates everyone who's willing to take part in this advocacy to increase visibility of epilepsy and awareness. The International League Zambia chapter is a professional body, so it's a bit restrictive. We only want professionals who are involved in epilepsy care, but the two bodies work hand in hand. So when the Epilepsy Association of Zambia is having any program, I support, I also take part. Yesterday, we're visiting Chainama Special School, giving out t-shirts and just celebrating the Epilepsy Day itself. So we work together, but if you need a support group, the Epilepsy Association of Zambia is there. They are on Facebook. You can just search for them. You can like the page and you can private message them and they will get back to you.
Thank you. I think we've come to the end. Though before we end, we usually ask our guests one question. Dr. Naluca, do you have the MedSearch Zambia app on your phone?
Sorry?
Do you have the MedSearch Zambia on your phone? Have you downloaded it?
No, I don't have it. I just see what's happening on the Facebook page.
We hope.
But
we
I
hope
think
now
after this,
Yeah.
I would download it.
Thank you very much, Dr. Naluca.
Thank you for having me.
This was MedSearch Zambia Health Talk, and we had Dr. Naluca. During the course of the week, we were running a competition, and we asked people to participate. And one person who really did a lot of awareness about today's show is Maria Kalokoni. So Maria Kalokoni, please do send us a message on Facebook, and we'll be able to send you your prize. That is a MedSearch t-shirt and your talk time. MedSearch Zambia is a medical platform that we created where we're able to disseminate health information that is affecting the public. Download the MedSearch Zambia app. That will help you find the nearest health facility, be it a hospital, a clinic, so that if you see a relative or a friend having episodes of seizures because of epilepsy, you're able to take them without wasting time. My name is Zangam Sakuzi with my co-founder, Dr. Moses Mata, and our guest, Dr. Naluca. Here at MedSearch Zambia, we always say MedSearch Zambia, healthcare simplified. See you next week.
MedSearch Zambia app, healthcare simplified.